I want to welcome everybody to the family tree. Put your hands together, family. Come on. All right, good seeing everybody. Everybody looking good. Everybody looking good, Big B. I want to get everybody started.
Playlist is flying tonight, boy. I'm telling you, man.
Yeah, feeling a little inspiration this evening.
I know that's right.
Yeah, you gotta say sometimes you gotta be inspired. You know what I mean? Some say encourage yourself. How about that?
Well,
y'all gotta learn to encourage yourself. I see you, Ruby. I see you now. I see you. She said didn't get nothing but an amen over here.
A big amen over here.
Wow.
That's right.
Don't you know?
Right. All right. We're going to come off there so everybody can see everybody.
Everybody is, yo.
Everybody in the family tree. All right. Yeah. Looking good, y'all. Want to thank
glad
y'all
I'm here with all these good-looking people, Dr.
All these good-looking folks.
All these good-looking peoples, man. I told you, boy.
Well, I want to welcome everyone to the family tree. If this is the place where you get your holistic health update for the week. You know, we call it the over the hump day.
Yes, sir.
You know what? Really, we get our holistic health. I'm so glad to be here with you this evening. Let this not be the last time you join us. Next time, bring somebody, we say.
That's right.
Each one, teach one. So we call it the family tree because this is the place where we say we gather around the ancient laurel trees. The ancient laurel trees are where we talked about situations, Big B, problems, anything going on. We gathered around a tree. It was a meeting place, networking place, but we prayed around that place because you know what? That was our social security.
Hey,
you gotta say it slow. Social security. It's also the tree of life. That's why even the Bible says
I know that's right, man.
Life. We got around that tree and we talked about whatever was going on. So with that, we say we invite you to the conversation. If you want to be a part of the conversation this evening, got a question, anything you want to be on your heart and mind, you can join the conversation. You know, go in on down by the chat box right down there and you see a reaction bar. Hit that with the heart down there and click it. And Big B, just like he got his hand up there, you can raise your hands and ask a question. If you're someone that's calling by phone and you say, well, you know, I don't want to go on camera, but I do have a question, you can put it down in the chat box. And I don't know if she's in here. Is she in here?
No, Fingers is not here tonight.
Fingers is not in tonight.
But Fingers 2 is here.
Fingers 2 is in the house. Rufy is in the house. We said Fingers 2.
Ruthie said, leave me alone. Get off my phone.
That would make her the second finger. She is in the house and she will get the questions and try to get the answers to you. We don't have all the questions right away, but we'll try to get them. We won't know all of them, but hey, we can actually ask. If we can't get to your question, we can't get to all of them because it may be time, but we'll try to get to all of them as much as we can. If you have at the end of the day or at the end of this program, we will give you the information. Big B over there will give you how you can get the transcript for tonight's program.
Yes, sir.
And in there, we'll have the questions and concerns and things that we have. If you're someone that's calling by phone and you may have missed the prompt where it actually tells you how to log in or actually raise your hand, no worries. Just let us know you're calling by phone and we'll get you in. All right. So I want to first get started by giving our host with the most, Big B, Bill 1L Morgan. Let's give him a hand, y'all. Let's give him a hand.
Yo, buddy. Yes, sir. Yes, sir.
What's up, buddy?
Hey, man, I'm doing Dr. P. Yes, sir, man. I went out and got my footsies in the dirt today. Boy,
you got your footsies
I got my footsies in the dirt, man. And then I had to go out and wash them off on the bottom because my wife said, you come in with that dirty hair, I'm going to punch you in your face.
You got your footsies in the place. Good stuff, man. Good stuff.
Yeah, man.
Big B, you know, we're watching everything. Of course, you know, the highlights are, you know, the FIFA's in town. You know,
man.
Of course, they've been about 2 or 3 matches now they got in here in Philly. And, you know, of course, we're watching that hantavirus. We're watching
man.
You know, the Ebola. You know, lots going on here with the storms. The storms are cutting through here, man.
Yeah, man. Yeah, buddy.
Storms are really cutting up. So, Big B, give us our latest numbers, if we have any numbers on the latest.
Dr. P, just like it's been for the last couple of weeks, things have been very, very small and skimpy. But for week 30, so like week 23, they're calling our number of specimens tested, Dr. P, was at 28,787. The number of positive specimens is at let's say 230, which is 0.8% of the whole group right now. Positive specimens right now, influenza A is at 56, 24.3%, and influenza B is 174, 75.7%. And that's it, buddy. So at this point, we'll take what I get, man. I'm gonna say, like,
yeah,
thank you, Daddy.
we're still watching the news on here, and no latest update, but they're still battling this thing over Ebola overseas right now.
Yeah, man.
And we're watching it because, of course, when we have people internationally traveling here to Philadelphia and all other parts of, LA and a lot of different places all over the entire country, of course, the concern is going to be Ebola in the areas, of course, crowd connection. So we want to keep an eye on that. And we'll say, what do? We just make sure that we keep jaws and paws. Make sure you're concerned wherever you are. That these all just works wonders.
Yes, sir.
And also keeps the mosquitoes off you, Big B.
Well, I know it's right, buddy. Yes, sir. Yes, sir.
Keep the mosquitoes off you. You don't have to worry about it in the backyard. Kind of keeps everything chewed. All right, we're going to get started. Of course, we start off with, we say testimonies. Testimonies go a long way. We start with testimonies because this is the time when I say that when people are going through that darkest hour, sometimes you got bad news, things that are going on. But you know what? We want to say, no matter what, someone may be listening today and needs a little encouragement. So when we have testimonies help those that are listening that, hey, you know what? It don't have to be all bad because, when you fall down on the back, if you look up, you can get up.
You can get up. Yes, sir, buddy.
And that every great challenge starts with one step. So with that, we encourage you. We want to give you encouragement for whatever you're going. You might have had blood pressure did well this week. You might have had, maybe you had no pain this week when you woke up. Or how about you got your water right? Oh, man, there's some testimonies, Big B, I get every week. I'm telling you, they come every week. So I want to give you the opportunity. Tell us what's going on. If you have a testimony you want to share with the family, we encourage you. Be a part of the family tree. The floor is officially open. Big B, floor is open, buddy. Anybody have a testimony they want to bring to the family?
Don't be shy, y'all. Come on
now. Bring testimony, family. Anybody have a testimony? Anybody?
Oh, wait a minute. Oh. I have one, Dr. Paul. It's not mine, but
okay, Summer. How you doing?
Bill, how you doing, Dr. Paul?
Doing well.
Good.
So a friend of mine, I sent a friend of mine to you, and she was told by her doctor that she was going to probably need a stent placed. They wanted to do a cardiac cath on her, and they told her she's probably going to need a stent. Her dad had heart issues, and I think I don't remember if he died of a heart attack or something, but I know heart issues runs in her family and high blood pressure. So I told her I said, you need to go and see Dr. Paul before you let anybody do anything. Go and see him. So she did, and she's been doing her natural green, her NGB, and she threw away because she used to eat a lot of processed foods. I mean, a lot of junk food. And she threw everything away, started, with her salads and buying organic. So she had her test scheduled because she had, I think it was like 40 or 50% blockages in like some of her arteries. But when she went back, they did the stent, not the stent, they did the cath, but they told her, they said, wow, you don't need a stent. So they did the cardiac cath, but she didn't need the stent. And he said, whatever you're doing, keep doing whatever you're doing, because he said, we don't need to put the stent in right now. So whatever you're doing, keep doing it.
Wow.
So I wanted to come on and tell you.
See that?
That's amazing. That's right. That's right. Stop.
Yeah.
I would say, Summer, I can't get the words out right now. I'm so happy for her.
Testimony.
Let's give her a hand. Give her a name. Give her a shout out. Give her a name.
Buddy.
Give her a name. Shout out.
All day long.
Yes. Everybody come off mute for her.
All day long.
Come on,
yes,
y'all.
sir,
Come
buddy.
on.
Yeah,
absolutely.
Praise God.
Glory.
Amen.
Isn't that awesome?
Congratulations.
All day long, man. Indeed.
See, we have to understand it's the plaquing up, and it's happening in the liver. I can't speak it enough. I really can't. It is not as deep as people think it is. When your body is always working on your benefit to cleanse the body. All we have to do is feed the body, and the body already knows what to do.
I know,
We are
that's right.
just basically just, letting the process. We have to feed the body these things like the red onion, the green drinks, the hydrogen, the life. Remember, life begets life. Only life can give you life. So if we get off the process, if you just leave it alone and increase your water and those balances, you're going to see some amazing things. And that's a wonderful, wonderful testimony. So I give her all, the congratulations. I mean, that is awesome, because I'm sure that took an incredible amount of weight off her mind and her heart,
It really, really did. Because like I said, it runs in her dad had it. It runs in her family. Her sister, I think, died from it. So, she was pretty scared at that point when she got that diagnosis, and her arteries were pretty clogged.
Wow.
And she told me, she said, Dr. Paul, you have the 7 different, I think it's 7 different areas. And he was like, well, it's pretty bad.
I tell the truth. I just tell you the truth. But but you know what? I tell people always, whenever people come through, no matter how the situation is, no matter how, it looks like it's grim, it is not. If you correct, the body corrects itself 11 times faster than you get sick. Big B, that's like for every dollar you got in the bank right now, I'm going to add 11 to it. How about that?
Well, shoot,
you take that bet, wouldn't you?
What you talking about, man? I'm going to put my hand at that too. If necessary, I'll take a gold bar
your
too.
Body regenerates, so the odds are with you. We've just been miseducated, misinformed, and that, of course, the food that we're in these deserts are the problem. So congratulations again. Give her a shout out.
Hey.
I'm talking about Summer. Give her a shout out.
Yeah, Summer, give her, yeah.
What, her name and all?
Yes.
Yeah, Christine.
Yes.
Okay,
yes.
Christine.
All right, Christine.
Yes.
We want to put it out there. Okay, we're going to give her good energy. Everybody give her some good energy.
Yeah.
All day long, buddy. Yes, sir.
The
Yes,
things
sir.
that she's doing. Yeah,
And
keep up and
Summer
doing.
invited to the call.
That's
That's
right.
right.
Always.
That's
I have, but she's so busy. But I have.
Okay.
That's why I told her.
But that's
I was
why
gonna get on here.
I'm saying we're going to give her a shout out. So hopefully she hears this, okay? Because a lot of times people get a little bit, of course, things happen. You got things scheduled. So at least she can look back on this call and say congratulations. All right.
Yeah.
Okay. Thank you, Summer. We appreciate that one. That was a good one. All right. All right. Who else now? Anybody else? Come on. Anybody got
Dr.
something?
Paul?
Mm-hmm.
This is Patricia. I have a testimony.
All right,
Patricia, come on through.
So I wanted to talk about the eucalyptus essential oil. I think one of your sessions you talked about the mucus in the membranes or something. I forgot exactly what you said and what it, like why it's there. But what I did was I have sinuses, and what I'll do is take a Q-tip and I'll take the eucalyptus and put a little bit on the Q-tip and I'll put it in each one of my nostrils and I'll inhale it. And let me tell you something, it's been draining old mucus. Like it's been like, oh, I could tell, you know when it's old mucus compared to new mucus, but it's really working and I can breathe better now.
Wow, that's excellent.
That's what's up.
Let's give her a hand,
right,
y'all.
Patricia,
Everybody give her a hand.
Yes, indeed. That's right.
Eucalyptus is amazing. That's the eucalyptus, of course, that's your of course your Vicks Vapor Rub. That's the major element in the Vicks Vapor Rub.
Buddy. Yes, sir.
It's very thermal, which means it heats you up. So it actually pulls that mucus out, breaks that stuff up. So now it moves it out of the system. It's also part of the we say the Thieves oil formula that we talk about. But eucalyptus does so much. That gum tree. They call it the gum tree. So it's always been used for times and seasons, and it always heats you up. So that's what it is. It has that menthol, scent to it, that menthol feel, and it's that aroma that pulls that stuff out of you. Doesn't it feel wonderful when you do that?
It does.
I know that's right.
It feels
Yes,
wonderful. Very clearing and sinus, because we have what's called the olfactory nerve. The olfactory nerves are right up here. You know what the olfactory nerves are? That gets your senses back with taste and smell. If you're someone that actually has lost the taste, you say, I don't know what food doesn't taste, or I can't taste anything anymore. That means you have to reset those olfactory nerves. So eucalyptus is one of them. So like you said, you take a little bit on a Q-tip, put it up in there, and it actually starts to move that olfactory to reset it. So it's toxicity drive. It pulls stuff out. It smells real good. No, don't it?
Yeah, do now. What can I
Yes,
say?
it does. I love it.
Yes. Good stuff. So congratulations, everybody.
Thank
Come
you.
off mute one more time.
One
Just
more
give her a
time.
hand. Come on.
Yeah.
Congratulations.
Congrats. Indeed. Yes, indeed. That's what's up, man.
Congratulations, Patricia.
Good stuff.
Thank
Good
you.
stuff, Patricia. Good stuff. Good stuff. Thank you for sharing.
You're welcome.
All right. Anybody else
Anybody
have a
else? Anybody else?
testimony?
Come on now.
Anybody else?
Okay, I'll go. I mean,
Go
y'all
ahead.
keep holding.
Go ahead, Ruth. Bring it up.
Go
Bring
ahead,
it up.
Ruth. Go ahead, Ruth.
I was trying not to say nothing.
You trying not to say nothing. You can't help yourself, can you?
I can't help myself. But actually, it really is a shout out and an honor to you, Dr. Paul, for the wisdom that you give us about knowing. One of the things you say, know who you're talking to.
Amen.
That's it. You got to know who you're talking to. That's right.
A very dear friend of mine. These people keep trying to kill them. The doctors, with their medications. Every time they called the pharmacist is like, no, you shouldn't be taking that. And the last thing that happened with this person was this has happened a couple days ago. They gave them some medication. Their legs started breaking down a little bit. And this person is allergic to amoxicillin. The wife goes to the pharmacy because the doctor said there's none in there. Goes to the pharmacy. She asked the pharmacist. So go to the pharmacist. If there's nothing I learned, talk to the pharmacist. The doctor don't know. The pharmacist says, there's amoxicillin in here. They call the doctor, and the doctor says, but it's just a little bit of amoxicillin.
Oh, come on, man. Didn't she just tell him she can't take it? A little bit of poison.
Just a little bit of poison.
It's a little bit.
Help us, y'all.
So please talk to the pharmacist because they know. And this is the third time with medication this has happened.
Wow.
Now, it's not in there. That's not in there. Call the pharmacist. Yes, there is aluminum in this medication. That's why it's so high. But the doctor swore, no aluminum. There's no aluminum in here.
The doctor needs to be reported.
Yes.
That is an incident report right there.
Yeah, reported to the state.
Absolutely. You got to jump on that and let them not, because if it wasn't for that farmers catching that, there's no telling what could have happened. You know, what is considered a little bit? Maybe they're allergic to a little bit. You know, that's the whole point right there. She just told you what I'm allergic to, and then you're going to make sure, oh, yeah, it's got a little bit in it. That's terrible. You know,
Yeah. So I just wanted to encourage us, please, you are your primary physician. You are your primary caretaker. They ask some questions. You got to know what you got to know because they don't.
Yeah. Thank you, Ruth. Let's give her a hand, y'all. Let's give her a hand for being on the floor.
Indeed.
You know?
Yes, sir.
Thank you, Dr. Paul.
And I'm sure you gave her pretty much a lot of good detailed information to stay on point. We say hold the feet to the fire. You got to be on point with this.
Yes, sir.
You know, it's a shame that we have to double check like this, but this is where we are right now. You know, people are not checking on you.
Advocate.
You have to check on everything. You got to be on point with this.
Yeah.
And absolutely, please make sure they do an incident report on that. You know, that's not good because that could happen. What about the next person that doesn't catch that?
Yeah.
What about the next person? So good looking out, Ruthie. You're doing a great job over there. Thank you so much. We appreciate you.
Thank you. Love y'all.
Okay.
Indeed.
All right.
Right.
All right. Who else we have a testimony over
Anybody
there?
else?
Anybody?
Joan, I see your hand. Joan Cromartie.
Yes, I got one. I went down to the gym today and did 1,140 steps on elliptical. And then the halls are so long here at my facility that I did over 2,000 in walking. And I think that's a very big deal because I'm trying to, help my knee to heal, but I had to do extra walk. So later on when we get off, I'm putting the ice pack on, but I thought that was a good thing. It was a 3 pound.
Excellent.
I heard that.
That is awesome, Joan. Let's everybody come off
Way to
mute
go,
for
Joan. That's
Joan.
what's up.
Way to
Hey,
go, Joe.
transparency makes the soul good. Joan said, "I'm about to put an ice pack on." Well, I got my steps in.
Amen.
I'm good to
Right.
go.
Praise the Lord.
Nice.
That's right.
That's
Congrats.
awesome, Joan. Thank you so
And
much.
thank you for a good visit, Dr. Paul.
Yes, I enjoyed the sit down with you, Joan. You are a true heart. I tell you, we had a great conversation. Big B, she had me rolling. Big B, she got jokes, man. She was.
Did you get my video?
I don't know. Did you text it to me or you email
Yeah,
it?
I texted. Maybe I should try to email it.
Okay, email it to me. Yeah, email it to me. I'll take a look at it. All right, thank you. Appreciate
You're
you.
welcome. Thank you.
She got her steps in, Big B, but the ice pack is rolling tonight.
That's right. And the comfrey sad.
I was just about to say, you remember we talked about the comfrey, right?
I got it.
There you go. There you go. Open it, Joan. Come on. Open it up. Open it up.
Joseph, be messing with her. I got my comfort. Who you think you're talking to?
Here it is. Look.
There you go. So
go
it's
ahead.
on.
There you go.
See that comfrey, y'all? Hold up. I gotta let everybody see this one. Joan, show them the outside of the can. Show them the outside.
Make sure
there
I got
it is,
it
right there. Yeah, DNA Organics Comfrey Salve. See that right there, y'all?
Yes,
Take
sir.
a picture of it. Keep it right there. Take a picture of that. See, this is what's good. That salve is excellent. It must be like a bee. Is that like a bee? Bee waxes with that. Check to see if there's bee wax with that.
You want me to look at this small print?
Oh no, that's all right. Don't worry. Don't worry about it. Don't worry about
it. What do you think this is? You gonna make me go get my glasses, man? What you talking about?
Did you put any on your knees yet?
I do. You see the dent in it? You see the nice big dent? Let me show you.
You just put some. You should.
That's it, boy. She said, "I'll be playing. I know what I'm doing."
They ain't playing around.
For real.
She said, "I'm for real."
Yeah, that's what that big dent means.
Everybody, come off mute for Joe. Come off mute for Joe. She throwing the comfrey down. Yeah, she making it happen, y'all.
Yeah,
she ain't playing around.
Congratulations.
And the dandelion herb I got
Great job. Congratulations.
That's right.
That's right. Joe said, "I ain't playing around. You must be playing with you. You know who you talk." There you go.
Who you think you talking to?
Who you think you talking to?
I just gotta get better with my water. That's all.
There you go. Well. Thank you, John. We appreciate you. All right. All right. Okay. All right. We got Mark. That sounds like Mark Kinsey over there.
Hello, everyone.
Yes,
what's
sir,
up,
Big
buddy?
Mark.
My last testimony that I did, I wasn't sound too good. Big B stepped up to the plate and gave me some scriptures for me to read and all that old good stuff, and I appreciate that, Big B.
Yeah, man. Yeah,
my mouth was out of hand, and I know for a fact sometimes Satan get in my mouth and say things that's beyond my wildest dreams, and I got to be careful with that. And when I feel like that, don't say a word.
Yes.
Right.
One of my problems that I have, I got hit in the eye for hardball at the age of 16, playing organized, 16, in high school, playing organized baseball with Northwest Raiders, and my pop hit the ball. It took a bad hop. It could have hit me anywhere on my body, but it hit me directly in my eye.
Oh, wow.
And I've been having problems, and oh God, it's just been crazy. So I've been dealing with this situation, and it's been pretty good. Now, every time I close my eyes and lift my eyes up, I see lights, and it goes away. And I had called my doctor, and he called me right back quickly, and got me in the hospital, the doctor's office, and they took plenty of X-rays. So what I have is hemi, retinal vein occlusion. What had happened, they took a picture of my eyeball, in my retina that is half and half blood up top and half below regular. And when I looked at it, I was like kind of scared. And they were saying that the eye itself is starting to look like you see white spots starting to subside. And they're going to have to monitor and see, you know, how well does it progress or whatever. But my thing is, eye break should be able to handle that, right, Dr. Paul?
Yeah, you got it. You got it. Yep. Any occlusions, any occlusions are basically it's a little clotting happening going on in there. So what you want to do is, of course, you know, the red onion teas. We talk about all the things that you do, the eye washing, the eye bright, you know, all those things work. Yes. But, you know, watch your processed foods though, you know, no processed foods.
Oh, yeah.
And I know you're on point, but but even when something is considered healthy, still watch the factor of the dehydration factor. See, it could be the best. It could be the best, you know, non-GMO is paleo. It's all the ones that you have to get, including across the board, non-GMO and everything. But if it's dehydrating, it's still not good for you. So it's pulling your moisture out of you. So just make sure that, you know, watch your food choices. Okay. And with that, eye bright. We say not to diagnose, treat, cure, prevent any disease, just food for the soul. Eye bright, okay, works really well. Of course, with the eye bright, you know, that Dr. Christopher's, you know all the stuff, Mark. You know everything. You know everything you need to do. Just make sure that you increase, you know, there is that lutein. Remember lutein? Okay, lutein with the zeaxanthin. Yep. Those are the things that you want to use. And there are some formulas that are already put together. I would definitely say.
Well, can you text it to me?
Yes, I will. Absolutely. Absolutely. There's a specific eye formula also I think that would be good for you. There is a lutein, and I believe Wayne Avenue has it. Okay. So I will text that to you. You know, I was trying to see if I can grab it for the rest of the family to see that particular formula, formula.
As a matter of fact, my doctors are willing to listen to me because I told him I do a holistic doctor, and they were like, "Well, go to him and see what he recommends and all that old good stuff."
Well, that's nice.
Already taken care of.
That's really good, man. That's good.
And it will make a difference too. You know, again. You do have to stay off the meats though. Okay, no meat. You know, I know you know about that. Yeah. And also another one family is really good is the bilberry or blueberry family. Any of the bilberry or the blueberry family. Yep. Works real well.
Plenty of blueberries. Yes.
Yep. All right. All right, let's give Mark a hand, y'all. Let's give him a hand.
Yes, sir,
Big
Mark. Yeah, man.
Go ahead, Mark. You got options. You got options.
You got a lot of good options. A lot of good options, buddy. Keep up the good work, okay? We're with you, man. Keep it up.
Appreciate the love.
And then also, you know, I don't talk much about this, but there's eye exercises. Y'all know about eye exercises? Y'all know about eye exercises?
No, talk to us about that.
Come on, man. Y'all know exercises?
No. Help me.
Yvette said, no.
Sister out. No.
Help us, sister out now.
I like that
response. I do.
No.
Right there, isn't it?
All right, let me see if I can find some eye exercise. There's some excellent eye exercises that you can do. You can, number one, get what's called an eye exercise app on your phone.
Oh, that's cool.
Yep.
Didn't know that.
On your phone.
Glad I came to
class. Now, it depends on what you have. In most cases, you know, you can have an astigmatism. I have an astigmatism myself. And then astigmatism is basically, it's the shape of the eye. See, I have almond-shaped eyes.
Go ahead. You got almond-shaped eyes. See, that's what you get.
So it tends to bend the light. So it's nothing about, you know, contrast or clarity. That's perfect.
Right.
But I have slight astigmatism, which means the eye bends light. So that's why when you put glasses on, it sort of bends it back into position so that it can focus. So it's sort of gives it like almost like a olive type thing going on. So there are exercises that can help to stimulate the muscles on the left and the right hand side and over the top and all around. So it kind of moves like this. See, like here, kind of grabs it like a ball and moves like this. So there are excellent exercises that really are beneficial. They really are beneficial. Let me see if I can find one that I can show you. And it's basically the combination of doing like this, near and far. That's what you're doing, near and far. So you hold something close to you here, you look at it, and then you look at something at a distance. Got it? So you're looking at your fingers, and then you're looking at the distance. And you got to basically do that for a period of time. And you can do these exercises on a regular basis. They do work. They do work. And they do help you with the process of that. So let me see if I can find something real quick, Big B. I'm going to see if I can find something. Go ahead to the next person. I want to see if
How many times a day do you do that, and how many reps?
There's no set time. You can do it as often as you feel that you need necessary, because they're very effective and it helps to strengthen the eyes. Some people are having, astigmatism, or they may be farsighted or nearsighted, but it helps with all the different variations of the eye. But it's, of course, we're feeding the eye, but at the same time, not only feeding the eye, but we're also doing things like, exercise. So it's very important to roll the eyes around in a circle, up, down, up, down, up, down.
I ain't gonna fall over myself, man, but Dr.
Don't know. You want to be sitting down, Big B.
I won't be falling over myself.
Make sure you're sitting down.
All right.
Let me give one. I have one here. Let me see if I can find one. I think I have one here.
Okay.
This is one. This is one type of exercise here. Okay, this is one type right here. Okay, let me see. I'm gonna see if I can grab this one. Let me see if I can grab this one, Doctor. She's pretty cool. I watch her all the time. And I kind of look at those that are really doing stuff out there that have dropped really good gems out there. So let me put this out here, Big B.
Okay.
Let me know when you can see it, buddy. All right. Can you see it?
Yes, sir. There you go, buddy. That's it, man.
Okay. All right. Let's check her out.
In this video, I'm going to show you how to perform convergence exercises. Keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and I'm not just an eye surgeon, I'm also a strabismus expert. I'm fellowship trained in strabismus, which is misaligned eyes. So I do surgery to either uncross eyes or make them so that they are no longer wandering out or even vertically misaligned. But sometimes I don't recommend surgery. Sometimes actually eye exercises can be of benefit. So I'm going to review how to perform convergence eye muscle exercises. And the only condition that I usually give these exercises for is for something called convergence insufficiency. That's when your eye muscles have trouble focusing up close. You might experience it as difficulty reading, even double vision, maybe headaches, eye fatigue, or eye strain. And it's a very particular kind of eye wandering or exotropia. It usually only occurs when you're reading something up close, and in the distance when you look at objects, everything looks fine. And that's when we know that if we strengthen those inner muscles, those muscles of convergence, we can improve your ability to focus up close and hopefully alleviate some of those symptoms. Usually for people, when they're looking at things in the distance, their eyes are straight, but when they're looking at something up close, their eyes wander out. Convergence is the ability for the eyes to move in when you're looking at something up close. So, for example, if I'm looking here at this little stick right there, as I'm looking at it, you will notice that my eyes are crossing in. And that's normal. That is linked to your muscles of accommodation, which is your focusing muscles. For some people, they don't have really strong muscles of convergence, so their eyes wander out when they're looking at things up close. So the very simple thing to do is called a pencil push-up. What you're going to do is you're going to hold a pencil arm's length away with the tip up. And it's very simple. You don't need to print anything. If you don't want to, hold it arm's length away. And as you bring it closer, you're going to try to keep the image of the pencil single. Everything else around you is going to double, but you're going to keep the image single. And you're going to bring it closer and closer to your nose. You're going to notice that there's a point where it starts to get really challenging. and the image of the pen or pencil might double. If that's the case, then you actually want to start over. You're going to pull it back up and you're going to start again and bringing it closer to your eyes. And then eventually the goal is to try to get all the way to your nose with the image remaining single and everything else is double. It's going to feel like you're really putting a lot of effort into it, especially if this is something that your eye doctor has recommended because you have an insufficiency or weakness in your convergence muscles. Now, at-home convergence exercises have been shown to be beneficial in treatment of convergence insufficiency, but not as beneficial as vision therapy with an orthoptist or an optometrist. But home therapy is better than nothing. So it's a great way to get started, especially since vision therapy typically is not covered by medical insurance here in the US, so it's considered out-of-pocket expenses. So if it's not something that you can do right now, then start with the home treatments. So again, what you want to do, hold it up all the way in and back out. That's one. That's like one down and out push-up. You want to do that about 15 times, 3 times a day. So it really only takes about 5 minutes to improve those muscles of convergence. So there you go. Very simple convergence insufficiency. I also have some extra handouts if you are interested. You can grab them right in my description below of things that I give my patients here in the office so they can at least get started on trying to work on their muscles of convergence. Now, in some studies, it was also shown that it's more beneficial if someone is actually watching you and encouraging you as you do these exercises, because they can notice when your eye might start to drift out and it's not crossed in. And if they bring attention to that fact, then you will actually pay more attention and bring the eyes in. So when they did a study where someone else was actually there observing the person doing the exercises were more helpful. So you might consider starting out by having someone watch you while you do it. It might feel weird at first, but I promise you it can be really helpful. And it's a really easy way to treat this disorder. All right, guys, so that's it for today. So if you wouldn't mind just taking a moment and subscribing to the channel and liking and commenting, I would really appreciate it. Until next time, I am Dr. Rupa. It was good to see you. Bye for now.
All right,
I'm liking already, man. What you talking about? Boy, I love that.
Good stuff.
I'll be able to see by in the morning, Dr. Paul.
Yeah.
Dr. Paul.
Yes.
Hey, Rose.
Yeah, hi, everyone. I don't know what this exercise could do, but I told my grandchildren, when you look at a screen, like a TV screen or a laptop, to look at all 4 corners, but don't move your head, but just go ahead and look at the different corners. But I don't know whether it solves or helps with the problem that she was talking about, but I think that's a good exercise too. And I've been doing that for about 20 years with my friends. So, okay, thank you. I just want to put that in and try to help someone.
Absolutely.
All right.
And this is the part 2 of this here's another one. Just like you were saying, Rose, you're spot on. This is one that you can go on YouTube and also do also. And it's just follow the ball, follow the red ball. So all you do is you basically, Big B, here it is right here. Let me know if you can see it.
You got it right there.
Okay. And all you do is follow the ball. See right here? That's all you do. It's about 7 different exercises.
Oh, that's nice.
Got it? Keep your head still, though. Keep your head still. Keep your head still. Got it?
Okay.
Go back. Same thing. Try to keep your head in one single position. And you do this every day, and you'll notice that you're strengthening the muscles in the eye. Okay, this is one. Comes another one. Okay, you would go through a set of that. Let me see if I can fast forward just a little bit. Yeah, here's another one. Here's another one. Keep your head straight, though. Keep your head straight. Try not to move your head or your neck. Got it? Y'all following this? Anybody having a little problem with it? All right, here's another one. The old figure 8 there, Big B. The old figure 8.
Over and down.
AFX racing set.
A little challenging. You're using muscles you don't normally use because
yeah, man, that's true.
Because you think about it, you're usually using your head more, and you're so the eyes lose their muscle ability because you're usually moving your head. So when you see something move like this 8 move over to the left, you're going to move your head that way. All right. So this one right here, keep your head straight now. Keep your head straight. I know you want to turn it. You want to turn it so bad, don't you? You want to turn your head, don't
That's
you?
to tell the truth, yo. I know I do.
You want to move the head, don't
you? Well, I can stay still and watch.
Right,
does this work for pets? If you have like a ball and you have it going around in a circle or something like that, does that work for their? Yeah, like for their eyes, if they're.
Well, I don't think you would get that attention.
My dog wouldn't do it.
My dog would probably try
my dog
to
look at me
it.
like I have lost my mind.
My dog be like, you got better sense.
Well,
You
how
better
about
give
a
me a
cat
bone.
then? My dog will follow it, but how about a cat?
Well, I don't think it'll be effective because they're going to be moving their head. They can't take direct instruction. Yeah.
Okay.
But that's a good point, though. Good point.
That's true.
But see how you're going back? You're using the up, down, you're going to left or right, going to the left or right. Try not to move the head. I know it's hard. Sometimes you want to move the head so bad, don't you?
Isn't that the truth?
No. Probably fall asleep.
Mark said he gonna fall asleep. He gonna fall asleep. All right, here's another one.
That one looks crazy right there.
Now this one right here. See this one right here? Oh, this is nice right here. I like this one.
That won't make me fall off my chair. Well.
Everybody, we got the whole Facebook probably looking.
What is wrong with it? Have they lost their mind?
They probably looking at Facebook like, what are they doing over here? Ain't that a challenge? Don't drop the head either. That means don't go up and down. Don't drop the head. Got it? Ain't that something?
Dr. Fawn, you find this under eye exercises?
Eye exercises. I'll give you the link for this one. This is a good one right here. I like this one. I love this one right here. This one right here helps you good.
Yeah. The links are in the chat already, Dr. Paul.
Okay.
Okay, you got it in there? Okay, good.
Thanks, Ruth.
Good. I like these. See, you can get into it, and you want to move the head so bad, don't you? Don't move the head. That's right. Let the eyes do the work. And if you do this on a regular basis, and if you can do it every day, you'll notice that you're strengthening the eyes, along with what the doctor was saying, the near and far. You remember I was telling you about the near and far.
Yeah.
That really makes a difference, and you can really see the strength come back to the eye. Your eyes will really start to reward you. But again, at the same time, while you're doing the exercise, what are you doing? You're feeding the eyes, right? You got to feed the eyes. All right, let's see. One more. Let's see this one right here. Moves a little faster. Oh, moving a little faster. Got to stay up with it. You want to move that head, don't you?
Yep.
But those are the same ones. It goes over and over again and again. So I would just say, take your time, do it a little bit every day. It makes a big difference. All right. Good stuff.
My eyes are dizzy.
Your eyes are dizzy.
Don't fall off that chair, Jay.
Yes. What was that again? It's called visual tracking exercise. Visual tracking exercise.
Dr. Paul, Dr. Lewis gives me that test every now and then. I had that cataract removed. And that's one of the tests that he gives you.
Great exercise.
He's the first from you, Dr. Lewis.
Okay. Excellent. Yeah. So just try to do it every day. You can put it right on your phone. Get that link on your phone, and just every day.
Good idea. Yep.
And just do the exercise. Just go through it. Just getting your exercise in the morning. That could be part of your regular routine.
And when you're on the phone, make sure you use that phone up here like this. Otherwise, Dr. Lenny will get you. You'll be holding your big head down. He'll weigh 1,000 pounds.
Dr. Lenny will get you.
Dr. Lenny's here too. He'll get you.
I'm working.
That's what Dr. Lenny said. You brought it in here.
Yeah, he did. I remember when I used to go to Dr. Lenny. He said, "Put that phone up here." I said, "Okay."
All right.
Anybody else?
Dr. Paul.
Yes.
Dr. Paul,
yes,
are these the pills you were talking about?
The pills. That's one of the formulas. Yep, that's one of the formulas. It has the bilberry, the lutein, the zeaxanthin, lycopene, omega-3, grapeseed, and resveratrol. Yep, that's one of the formulas right there. Yep, good form. That's a good variation right there. Excellent formula, all in one. Yep. So while you're doing the exercises, you perform one of these. You grab one of those, like the formula that she has, and also, Cecilia, that formula. Where'd you get that one from? That was Wayne Avenue. Where'd you get that one? Well, Pollux, where did you get it from?
Where did you get it from, Celia?
Did you get it online? Cecilia.
I can't remember. I had it a long time ago.
Okay.
I can't remember. I had it a long time ago.
Okay. But that's good. That's good. That's the formula.
Well,
What's the brand? What's the brand name? What's the brand?
Type the brand name in the chat.
Yeah, that's a good formula. And a lot of you'll notice that a lot of brands will have that same formula. It's a kind of commonality formula. So keep it good. Good stuff, y'all. Good stuff. All right. You nice and dizzy, ain't you, Big D? You nice and dizzy right now.
All right. Anybody else? Y'all?
All right. I think we're good on the testimonies. Okay. And let's go to the top there. Let's see who's at the top, Big B, or you want to go to Facebook side?
Well, you know what? There are a couple on Facebook here. Let me see.
Facebook fan, we want to shout out to everybody over there.
Angel wanted to know where you could purchase that, which I guess you're in the process of answering right now.
We'll get that up. We'll get that link up.
Right. All right, but I did have a question inside on the chat. This is from Maxine. What can a man do to boost his libido?
Oh, we did that whole libido last week. You remember it was Men's Day last week, and I talked about the men's formulas. If you go to my website, drpaulherbs.com, you can go right to the download section, and there's several different herbs that we use for libido. One is the Tangat Ali. Remember we talked about the Tangat Ali? We talked about a few this weekend. If you go to the website, I'll show you where to go. Okay, go to the website here. And these are for a lot of things. Any man, I would say every man should download both of these articles. It's the 15 potential causes for prostate cancer, but also gives you all of the effects of what men deal with. So, Big B, I'm going to make sure I bring this up. Let me know if you can see it. Bring my website up.
Yep.
Okay, so go to my website, www.drpaulherbs.com. That's with an S.com. Go to the download section right there. Boom. And then when you slide on down, you're going to go to these two articles right here. Traditional herbs for men's prostate health. These are some of the most prevalent herbs for different issues with men. So this is for every man in your life or men. This is something you definitely want to keep down in your repertoire. These are the herbs for incontinence, testosterone, blood and urine, enlargement of the weak prostate, erectile dysfunction. These are all the things. Premature ejaculation, stimulating libido. Here you go right here. We talked about a little bit of the, there's one called epimedium. Okay, epimedium is, they call it the horny goat weed, but it actually helps to stimulate the libido, the drive. Damiana is very good for that. Damiana. But again, with these, I would definitely check to make sure that you're not on any type of blood pressure medicines, because they are adrenaline stimulants. So they move the endocrine system. Sometimes, men want to get the moving of the driving of the system, but the system's saying, well, why are you driving me? Are we doing something? Are we exercising? So that means don't take these herbs and don't exercise, guys. Got it? You got to exercise. So inflammation, blood flow, and also strengthening of the prostate. You see it. Tribulus is a good one. That's the one I wanted to get to. Tribulus. Tribulus. Not to diagnose, treat, cure, prevent any disease, just food for the soul. Tribulus is one that is for strengthening, for those that are lifting weights, trying to get your strength up as a man, muscles, all of the things that we do, but also it strengthens the prostate. So that, of course, with all these things going on, increases the adrenaline system, but also the endocrine system. So now starts to move the libido. So now they have a desire for having sexual intercourse, if they're having issues in those areas. These are all balancers that you actually do. So every man should download this list, y'all. This is your list. This is when we do the men's health programs. This is the one you want. Also,
where do you download that? Where do you download it?
I just walked you through the site. Right? Go back to the website, www.drpaulherbs.com.
Oh, okay.
Can you see the site? Are you watching or are you on phone?
I'm on the phone. I can see it though. I see it now.
Okay, so right when you go to the website, download, go to Traditional Herbs for Men's Prostate Health. Got it? Now, also with that, I go 2 and 2 right there. Grab this one also, 15 potential causes for prostate cancer. These are always the ones that we watch for. Of course, these are the prostate checklists: constipation, dehydration, acidosis. Kind of sounds familiar, don't it, y'all? It's kind of for men and women. Refined sugar, refined salt, refined oils, heavy metals, processed foods. You got the list goes on. Also, with that, I give you the natural shielding stones for protection. That means men don't hold your phone in your pocket.
Pockets. Yes. Yes.
One of the number one causes for that is what? Holding it in your pocket. Don't put your phone in your pocket. And also, seniors, don't take your phone and put it in your chest area.
In your chest area.
In your chest pocket. Or, gentlemen, don't put it in your coat pocket. Got it? It's right next to your heart. You got 5G right next to your heart. Got it? Don't do that. Those things are the electromagnetic fields are way too high. And we're moving up to about 6G coming up soon. So make sure you do that. Okay. So those are your numbers. Those are your those are your 2 articles that I recommend. Make sure you go ahead and download those. Okay?
What if you have an RFD bag?
RFD, that can help. Absolutely. If you have a Faraday shield bag, they work. They very work. I keep those around my house, especially when I come in, as far as where my keys go for my car. Faraday shields do work. But just keep in mind, when you put your phone in there, you can't get any coverage. You can't get any signal. It's going to cut it all. It will cut it almost all the way off, pretty much. So unless you want to just shut it down, you want to shut your phone down, that's what you would put it in that Faraday shield bag. Okay. Y'all seen a Faraday shield bag before, right?
No.
Seen one before?
I just bought a set of 5.
Yeah, you want to see? You got one? Anybody have one that they can show?
Yeah, I can grab mine real quick.
Grab yours real quick.
While she's looking for Dr. B, for those who are actually on and can see, I've actually loaded at the 8:14, 8:15, the 2 articles into the chat. So you can click on and just download it right now on your desktop.
Excellent stuff, Big. Thank you, buddy.
Shout out, Big B. Appreciate you.
But the Faraday shield bags are excellent because you know how all these cars are getting, stolen. And they're getting stolen right outside your house, y'all. So these Faraday shield bags help that your phone, which is your fob on your phone, on your key.
Yeah, your key fob.
So they're constantly emitting a signal. So what they're doing is going out with these special laptop and these antennas, and they're grabbing your signal. So if they grab your signal, grab the signal, copy or clone the frequency to a dummy, opens right up your car, they're gone. Got your car, they're gone.
There's one right there. Dr. Corinne's got hers up.
Okay, Dr. Linda, you got it?
Yeah.
Okay, let me see it. Let me put you on spotlight there. Yeah, go ahead. Yeah, pull it back just a little bit. Pull it back a little bit for him. A little bit farther, a little bit farther, a little bit farther, a little bit farther, a little bit. There you go, right there.
That's the one for my key.
That's your keys.
Then I got a set of 5. So I want one for my key, one for my phone, one for my notepad, and one for my laptop.
There you go. That's it. So if there's something hitting, it ain't gonna be knocking your stuff out.
Can you put the spelling of that bag in the chat?
Faraday, yeah.
And you can get it from
Faraday
Amazon.
Shield. You know what a Faraday shield is? It's the Faraday shield. Is the inventor that came up with the shield that actually shields radiation and all types of light. So things like when you see your Your microwave. If you have a microwave, you see that little mesh kind of looking thing that bounces back the signal back into the into the actual field of the actual, box itself. That's what the Faraday shield does. So it's one that you can get these bags online. I think they come in packages because I got a pack too. I got like a pack of 5 or something like that. Yeah. So they're excellent. And yours has the Velcro on it? Is yours with the Velcro? Yeah. That's it. Yeah. Yeah. They're very good. Very good.
How do you use it with your computer?
You get it size. You just buy the size that fits your computer. Slide your computer in it.
Mm-hmm. Or you can shield over your computer. Yeah.
Yeah. You can shield it over it too. Yeah.
Yeah. Okay. Thank you. Appreciate you, Dr. Brandon. Appreciate you.
Okay.
All right. All right. Let's see, Big B. Who do we have next?
Anybody on Facebook, Marie says, "What does losartan do for statins for your to your organs? What does losartan and statins do to one's organs?"
Well, you need to look at that on them side effects.
That's right.
Are you watching the side effects? You got to look at the side effects. Losartan specifically, all you got to do is go to, and this is with all your medication. This is with everybody. Go to punch in Google, punch in losartan side effects. Okay. And let me give you an idea. Just as fast as I just talked to you right here. Let me pull it up real fast. Okay. Losartan is a prescription medication used to treat high blood pressure and protect the kidneys. While generally well tolerated, common side effects include dizziness, fatigue, back or joint pain, nasal congestion, and mild digestive upset. You got it? So I want you to keep this in mind. You can do this with all your medications. This is for anybody. If you have those signs, if you have any of those symptoms, what does it say? Stop. Contact your doctor right away. Got it? But that sounds like acidosis, doesn't it? Doesn't it sound like they're in a state of acid? It sound like they really dehydrated.
Yes, it does.
It does. Doesn't it sound like dehydration? See?
Plus, it slows the heart rate.
Slows the heart rate sometimes. I mean, lightheadedness. I've got so many signs of people who had lightheadedness. That's the main thing. Back pains, because of course the back, when you're dehydrated, it's going to pull the moisture out of your back, and then you're going to start having back issues. So keep that in mind. All right, good stuff. All right.
Okay, Dr. B, this is Christine. Is bergamot extract okay to use for lowering cholesterol? Also, is there anything bergamot, it says BERGAMOT for cholesterol. Yeah. Also, absolutely. Is there anything that can help dissolve calcification in the carotid arteries in the neck?
Well, we know anything we're going to break down any types of clotting, we go to the alliums. So, we talk about the red onion tea. There's nothing simpler you can do than this, y'all. The red onion tea is it. I mean, it's, it's been used for thousands of years. When they found it in the ancient tombs in Egypt, that they were knowing the effects of what it does. It keeps your arteries clean. So bergamot does well too. Bergamot is actually used for cholesterol because it actually is good for the liver. Remember, it lowers that LDL or balances balances the LDL because the body still makes it. So it just balances the HDL and the LDL to the point where it keeps the markers down. So yes, bergamot is very good. Very good. And it's something, but whether it's for you, that's something that determines after an assessment to see where you are. But most importantly, what do we say with any herbs? Make sure you're doing what? Drinking plenty of
water.
Spring water.
That's right. Spring water bottle
at the source.
There you go. Bergamot's very good, though. All right. Okay, what you got there, Big B?
Okay, this is from Wanda Myers. Says, approximately how long will it take my system to get used to the abundance of fluid intake before my bladder calms down? I've been drinking for 4 straight days.
Well, it depends on, number one, what kind of water you're drinking, because, I'm going to go back to the water. As long as your water is correct, spring water bottle at the source. The toxic load is the key. See, sometimes it's going to take more than 4 days. But the key is the body's looking for consistency. Got to reach that threshold to where the body gets past the point of toxicity overload. See, what happens is when people say, see, that's why I don't drink water, Big B, because every time I drink water, I got to go to the bathroom.
Yeah,
immediately. But that's a direct sign of toxic overload, meaning that your body's saying, any water I get, flush it out immediately. And that's why people are doing that. So when people are actually drinking water, goes right through them. But the key is they stop. They really should not stop. They should continue to do it. It's going to be a little inconvenient at first, but if you stay in there, hang in there, and continue to do this, you will raise those levels and that reach that threshold. And then the body says, all right, we got rid of it. Now we can start to manage that level. But you got to keep going, especially if you're on a pharmaceutical, if you're on, you're kind of balancing between pharmaceuticals and trying to do herbs at the same time, because right when you're doing the good things, you're doing bad things. And then, of course, what you're eating does play a part with that also. So can't be, drinking water and eating crackers.
Well,
you can't be eating cookies and cakes and pies and all that stuff.
Crab leg.
At the same crab legs.
So, Dr. Paul.
Yes.
When I drink the red onion tea, does the water that I use with that tea count as water?
Nope.
Yeah, I think everybody on this call can answer
that question. You should say, Wanda, look at all the heads going left to right. Nope.
Remember, tea does not constitute as your total intake for water. That's right. Because remember, your body has to extract the water from the tea to get it going. So I got to use energy to get energy. So the body says, just give me water, and that I can deal with that. So your total intake of half your body weight in ounces doesn't constitute when you're taking teas. Yeah, keep that in mind.
Okay.
All
right. Let's go up in the corner to Summer up in the corner. Summer, and then we'll have Deborah. Summer, you there?
Hey, Summer.
Hey, I'm here. Surprisingly, you were talking about water because my question is about water.
I knew it. That's why we came straight to you. So there.
Yes. So you had mentioned Kangen water system, and my sister bought a Tyant water system. Is it what's the difference, or are they both the same?
Well, they're not the same. They're different brands. That's what you're looking at. You're just looking at brands with different. Is that what you're talking about?
Well, no, I know that they're different brands, but what they do, like it's not reverse osmosis, but what is it that Kangen does that makes the Kangen water system a good system? Because I'm looking at Tyant to see if they do the same thing as Kangen.
Okay, so I don't know what Tyant. Give me the information. Give me, how do you spell it?
It's Tyent.
Okay, Tyant water.
Yeah, Tyent, Tyant.
Okay, and Tyant looks like it is a water system. It's an ionizer. I do see ionizers here.
Okay.
So it's the same thing. The ionizer is the science. It's the technology. Now, here's what separates the difference between different brands that are out there. It's always going to be the manufacturing of the actual unit itself. Each one has platelets inside of them, and platelets are negative and positive charge. So their warranty is always based on the parts that it's made by. So some will have better made parts that last longer than other machines. I'm gonna tell you, it does matter. Kangen just happens to be sort of like the flagship. For many years, it's been the flagship. Not to say it's not any better, but, sometimes people are saying, Kangens last longer. In Japan, the original owner or the designer of them has them in all the hospitals in Japan. How about that? So they saw the importance of this, so they implemented it in their hospitals. So ionizer is not bad. It's just what you got to understand, the parts that you're getting. It's the difference between getting a Mercedes and getting a Toyota. That's the difference. Okay. That's all it is. Same technology though, because it's ionizing. So there's a positive charge plate and there's a negative charge plate. So the positive charge plate, when it goes through, the filter filters the water and sends electrical charge through the water. Positive charge becomes acid water, which goes at the bottom, and that releases at the bottom. That's good for things like oxidizing pans, and it's high acidic water. It has its uses that goes down in your spigot, down in the lower part of your sink. The negative charge, which is alkaline, goes on the wand. See that wand? You know, the wand that goes on the top?
No.
Make sure you mute yourself.
Oh, you
Zoe,
want me to
mute
change
yourself.
Mute yourself, Zoe.
Zoe, mute yourself.
Okay, thank you.
I got it. So the other one is a wand that comes out, and the wand goes into high alkaline water. Now, some of them may also be more expensive than others because they go higher in the pH. Some of them will be 7.0, 7.5, 8.5, 9.5, and even they get into the levels of high alkaline water, which is 11.5, not for drinking, but for things like cleaning fruits and vegetables and things. That's what I use it for. Okay, so that's what you're really paying for. It's based on the machine, and you got to look at their track record. But the science is pretty much the same across the board. It's the parts that are involved. Some of them have cheaper parts. I'm gonna tell you, they are some of them cheaper. I don't know about.
It makes a difference, boy.
I don't know this brand though. I'm not familiar, but I am familiar with the Kangen, and they are the best when it comes to parts because they really have a reputation, and they are in all the hospitals in Japan. Okay.
My sister has used Tyant when she lived in Virginia. And so I was telling her about Kangen and she said, well, she's been using Tyant for years and she's never had any problems with them. And the thing that she likes about them is they come out, they meet with you, they install it, they talk to you the whole nine. So she, like I said, went with Tyant. So I wanted to know what the difference was.
Yeah, there's no difference. The science looks good. And of course, it's customer service with any card. It's the difference between, like I said, a Mercedes. You get to the dealer and they're like, you want some coffee? You want to go over here? You want to have this and that? And then it's coffee like, your car ready.
So I do have a question. You said you use that for wash your fruit. So you turn up the pH to wash your fruit? Okay.
You
and
raise
then you
it
turn
too.
it back. Go ahead.
That is correct. So even like my machine, it talks to you. It talks to you. It tells you high alkaline water, high acid water. It'll actually, most of them talk. So they let you know what's coming through. So it comes through the filtering process. I have a little dual filter thing going on because it's based on, if you want to, specialize it, you can have these pre-filters that it goes based on where you live. Like some people live in high areas where their water is just really hard. So you have to have a softener. And then some places are really high in chlorine or maybe fluoride. And people's like, I don't want that in my food or in my water. So you can get these dual filters. That's the website I sent y'all to, called microwaterman.com.
Right.
I remember that, right?
Yep.
So you can get the pre-filters.
What do you put your pH for your drinking water at?
I'm usually at about 9.5.
Okay.
Yep, I usually keep mine in, but that's something that you gotta raise that up. You have to, if you're someone that's not used to that, you gotta crawl, walk, run till you get to that.
Gotcha.
I've just been doing 9.5 for like years.
Okay.
My dog drink 9.5.
Okay.
Hey, Summer. That's why he got hair and I don't have
That's
none.
why he got that golden thing going on so good. He's like,
Well, Dr. Paul, what's the range of for drinking the cayenne water, Kangen water?
What's the Kangen? What's the range?
The range, like you said, you're 9.5, but what would be the lowest?
The lowest. Well, I believe it can go as low as like 5.0. Yep, it can go really low.
5.0? Would somebody drink 5.0?
No.
Oh no, I'm talking about the part that you would drink.
No, it's about no lower than 7.0. Yep.
Okay, 7.0 to 9.5 or to what? 7.0 to what for drinking?
To 9.5.
9.5. Okay.
Yeah, that's what I recommend in that area. Yeah, but you got to train yourself before you get past up to 9.5. Some people, when they drink 9.5 right away, they're not used to that high level of alkalinity and they start to get a little headache because it's a lot of alkalinity. And it's like if they're very acidic, it's like taking cold water and throwing it on a hot fire.
Ouch.
Yeah. They get a little headache, they get a little dizzy. Yeah, you'll see that. But that's the normal process. That's why we say crawl, walk, run. So when you get your Kangen machine, start off with like a 7.0, and then you gradually move up. And also remember, it amplifies everything you eat with it. So that's why when you take your medicine, it's a little bit of like a little meter on there saying This is the one for taking medicine. It's like a 7.0. Okay, something where it'll tell you don't take anything past a 7.0 when it comes with medication.
So you need to know where you are with your pH.
You got to know where you are with the pH. That's correct. And that's why it talks to you. It's to let you know, like, hey, don't go past a certain number because, medication is going to amp up your medication, makes it that much stronger. Remember, I told you, when you have the presence of energy, anything you have that hydrogen, it increases the energy wherever it's present. So that means your food's going to be better. Everything you eat is going to be, you're going to get the maximum out of everything. So that's why it's so important. These ionizers are amazing. If you want to find out more information about that, you can go to my website. It's on my website where you can actually go to the eNagic. It's called eNagic, enagic.com. You can click on it. You can use my login piece. Is a little ID down at the bottom number. Use that, and you can go in and take a look at it. Okay, let me see if I can do it real quick for you. I can show you.
Okay, while you're doing that, keep this in mind. Audrey on Facebook. Is castor oil okay to put on your joints? Arthritis in right knee has me walking with a cane. Any recommendation on anything? I use Voltaren for pain, but it doesn't help much.
Well, castor oil is good for everything.
Everything.
Everything. Yes, you can put it right on the knees. Of course, we talked about several things that you can do in combination with castor oil. Traditionally, you can use the clove oil. Make sure it's 4-to-1. 4-to-1. So things like that. So there's a lot of things that you can use, but the key is I'm going to always ask you, what are you eating? Got it? I'm always going to come back to that because what you're getting, the inflammation, is the after effects of what you're experiencing. It's what you're eating. You got it? So you got to watch that. All right, let me go to here. I'm going to show you where this Kangen machine is real quick. Come on in. We got more folks coming in, Big B.
I second that emotion about the castor oil.
That's right. That's right, Neetha. I know that's Neetha. I heard you. Neetha said yes.
I second that emotion. Have mercy.
You second that emotion. Ain't that a song? Yeah.
Yeah, wow, that is.
Yeah. So here is my website here. And it's all you got to do is just go all the way down. And you can see change your water, change your life, investment in a Kangen machine, water machine for your family. Never have to buy water again. That's my number right there, 615-6049. And what you do is just click on the link. Click on the link, goes to the website, and you can see what's happening with the machines. It is expensive. This is one of the ones you have here. But again, you can do different types of payment plans for them. They got payment plans. Yep. Here are some of the brands that they have. And let me tell you, like I say, you never buy water ever again. All right. So that's one method. Now, there is another one, Big B. Then, if you want to find more information, go to my website and you can click on that and you can go right to the link and see what I'm looking at right now.
Yeah.
Right? Yep. But there is another, Big B. There is another. Did you know that there is another level of new energy waters that's going on?
Talk to me. Help a brother out, man. What you talking about?
This is cutting edge. Y'all ready for this?
Hey, Debbie, he's been keeping stuff. He don't want to tell us all.
I've been holding out on y'all. I've been holding out on y'all.
We ready.
All right, here we go. I want to show y'all that did you know there's a possibility, which I met this guy about 20 years ago, and he was out in LA, right? And this guy was like, hey, man, I got this machine that actually is for water. And at that time, I was thinking about the Kangen machines, and I was doing all the stuff. I was, doing the whole health piece. He says, no, man, he says, the new thing is going to be one day you're going to be able to take the water out of the air.
Out of the air.
I
was like, right.
What?
I was like, man, get on out of here, man.
Be smoking something, man.
I'm like, I'm totally in disbelief of this, right? But then when I started doing the more research, he was absolutely correct. There is a company, and I actually bought the machine. I'm testing it now, though. So I'll let y'all know what the deal is. But it's called one of them. Let me see if I can pull it up. Y'all want me to pull it up? Let me see.
You might as well. You got the bug out the bag, so might as well let us.
I better pull it up after I didn't talk about it.
Because they be talking about this. But can you believe Dr. Ball talk about this and didn't enjoy it? Man.
Yeah. It's another investment. And these are called atmospheric water structures. Got it? Atmospheric water, which really means that it grabs water out of the air. I mean, this is some mean stuff, Big B.
Like the tree.
How does it work? Yes, like a tree. Right.
Isn't that like dehumidifiers? Like
it's
if you
almost. So
okay.
Actually, the way they're called atmospheric water generators that turn air into clean drinking water. So I'm going to show you this website. This is one of the websites that the one that I'm working with now. I got this team that I'm working with, and they've been pretty real open with me. I've been asking all the questions, and I'm doing all of the, I'm doing the due diligence right now. So I'm going to let y'all know how it goes. So I've known about the technology, like I said, for about 20 years. It is possible, and it's very real. So here is the machines. I'm going to show you what the machine looks like. And Big B, let me know if you can see it up there, okay? Come on in. More folks, come on in before I go on. All right, here he is. Can you see
it? It is. Yep.
This one's called altitude water. Altitude water. And altitude water, how it works. Let me pull that up. How about that? Let's see how it works. Anybody ever heard of this, by the way? Anybody ever heard of this? This is the first time y'all hearing this?
Yep.
No, there was a black man that was doing it. I can't remember what country, and they shut him down.
Yeah. I actually know that guy. I know that dude. He's been actually doing work in Ghana. So a lot of people are doing this, but I want to show you how this thing works, okay? So I'm going to pull this back. Let me see if I can expand this a little bit. Maybe I can do this.
There you go.
Got it?
That's it. Yep.
Okay, let me see here. All right.
Unmute it. There you go.
Okay, so you see what's happening here. I want to get into what actually makes it happen. See, what happens is when it goes through the process, here it is, why the system is different from traditional water systems. Most drinking water comes from groundwater systems that are vulnerable to pollution. You know how we talk about it all the time with the pollution, aging infrastructure, environmental runoff. Altitude water bypasses the risk entirely by generating water from the atmosphere level, delivering pure, potable water that is resilient to drought, contamination, and water supply disruption. You know what's happening in the Rocky Mountains right now, y'all? Y'all know what's going on in the Colorado River? I'm sorry, Colorado River. It's running dry. It's running dry.
I did hear it.
And with these new data systems that are happening, the data systems are running dry. Literally, they are running dry. And guess what that supplies? Not only most of the Midwest, Las Vegas, California, large part of California, Utah, all those areas up in there actually are looking at drying conditions. And if they don't get some water real fast, we're going to have a serious problem. So this is one of the solutions that they're pushing heavily. As you can see, this is the cycle for what it happens. And when it goes through the process, the water, it grabs it out of the air, hits these condensing coils. See this right here? It hits these coils, and these coils actually now move water into capture it, filters it into a sort of an ozone filter, and now you got drinking water. The average amount that you can get out of here, based on where you live, if in the atmosphere and humidity, you can get about 5 gallons of water a day.
Wow.
Do y'all hear that? That's amazing. That's amazing. And all it doesn't do anything but sit there. They pull the water out out of thin air. System draws moisture from the air using advanced condensation technology, the same process clouds uses to create rain. Unlike tap or well water, the water never touches the ground and is naturally free of pollutants. Now, of course, what was my first question, y'all? What was the first question you think I asked them?
How safe is it?
Yes. What was the first question? That was my second
question. How much it cost?
That was my third question.
What was the
Minerals.
What's the
Is
pH? Because
What's the pH of it?
What's the acidity?
Mineral content.
That's the first thing I asked. I said, what was the pH? What's
Yeah.
the purification processes? What is it purifying? Are you doing anything to it afterwards? Got it? And that's exactly what they were saying. Well, this water, what they're saying is, and I said I'm testing it right now, they're looking at somewhere about a 7.5 to 8.0 on the pH. That's not bad. I was very, very impressed with that. I said, are you sure now? Because if I buy this and I'm trying to find this thing and I see it was there, I'm sending this back to you.
I know that's right. Yes, sir.
So I'm testing it now over a long period of time. We're going to find out what it is. I will get back to y'all and let y'all know what the deal is. See if it passed the test. And again, this is another way of getting water. Isn't it amazing? Did y'all know that you could actually get water out the air like this?
Yeah.
To a water, and it sits like this. Look what it looks like. It looks like a little water cooler. Except that it doesn't have the container on the top. That's it right there.
Right.
That's it right there.
Okay.
That's it right there.
Interesting.
Looks like, matter of fact, if I go to the front page, you can see how this is the machine right here. I've been talking to several of the guys there. They're real cool too. Very cool gentlemen. Very cool guys. And you can see how they're putting them in infrastructure around the world. There's a lot of them that are going up in places like Africa. Of course, with the UN, see here, right here, they're using it here, for
in Africa.
And places like that. This is the machine right here. You got residential office. I think the one, Dr. Renda, you talking about is the guy was in there's different variations out there. Like the brother was doing it also. He had a tractor trailer size one that he sort of just dropped. He dropped it in Africa, and then they've just been using it. So yes, actually, matter of fact, I have a connect with him. So he's a good dude. Good dude. I don't know. I didn't hear he got shut down though. I didn't hear that.
Yeah.
That he got shut down. But you can see what's going on though. That's the machine right there. See how it sits there? Nice build, nice way of doing it. Up to 15 gallons a day of pure water from air. If you in certain climates, it doesn't matter where you are and where you live. That's what I've noticed. And there is a humidity. When you get into the details, they'll tell you how the humidity rate does matter. The more humidity that you have, the better the water quality, things like that. So this is the one that's in Lahaina right now when they were having, of course, the things in Maui, of course, the wildfires. This is how they brought fresh water back to them. So it's amazing technology. There's some great stuff out here. We're living in amazing times, y'all. Do you know that? We are living literally in amazing times where you can see some amazing things. So I'll keep y'all posted and let you know. But it's always good to know that there's other solutions to getting things done. Wow.
Yeah.
All right. Listen, Fingers is not here, but it's 8:48. So you ain't going to get me beat up. I'm going to tell you that right now.
All right.
Okay. So we got Deborah, Netha, Decoya, Lisa, because of Lydia and Danny. So
all right.
Look, that's on you now.
Okay,
I'm putting it on you. So if I get beat up, we know who's coming. Go ahead, Deborah.
Hello, family.
Hey,
Haven't
Debbie.
been able to attend in several weeks, but I'm back now. So I have two questions. I did share with you, Dr. Paul, about my knee, and you suggested cysts.
Quadrangularis.
Yeah.
Okay. Big B's favorite word now.
Yeah.
Yes. Now that I can really say it, lady, you know what I mean?
He quick too. He quick.
When I checked it out, though, it said, and I'm a diabetic, so it said that it wouldn't be necessarily good for diabetics because it would take me low.
Well, here, remember, you got to look at whenever you see studies like that, that's going to be across the board with any herbs whenever you're diabetic. And here's why. It goes back to what? What's the biggest issue with diabetics? Concentration.
Okay.
Got it? That's the key. So that means what do you have to do? You must drink a lot of water. That's across the board with every herb with diabetics. That's why we say 2 to 3 hours before or after medication. It's going to be a factor always with diabetics because remember, it's pulling moisture out of that pancreas. So that's across the board. Okay, that's with all herbs.
Okay.
Mm-hmm.
Okay.
So it's not something of a major concern. Now, if there was a conflict with a specific thing that causes a conflict with the medication, that's something different. But in most cases, it's the water. Whenever I look at those studies and they always say, oh, well, the studies were that they took the rat or the mouse and they did this and they did, and then one that they never do, they never give it any water. They always wait till the liver fails or the pancreas fails. Never gave it any water. So that's the key. Or herbs demand water. So you got to make sure that's there. Okay, keep that in mind.
The other question I have is, I've been washing my eyes out.
I'm doing 2 things at one time. I'm on the training Zoom and then watching.
Nita.
You doing 3 things. You talking on about.
I'm sorry.
Okay, go ahead.
I've been washing my eyes. My question is, we're concerned with the plastics in the water.
Mm-hmm.
So washing my eyes with the water is still okay?
Just don't use the water with plastic in it.
Use Crystal Geyser. Use Crystal Geyser. That's what I use.
I use the Crystal Geyser.
Right. So here's the thing. Okay. This whole plastic thing has just gotten attention. It's always been here, y'all. It's always been here. If we're talking about being aware of plastic now and the PFAS, that's because they finally got the technology to actually see what it's really doing and how it's blocking up people's bloodstreams and finding it in a placenta, all the things that it's doing to your skin and your hair, your nails, it's everywhere.
Right.
But wait a minute, we kind of late because remember Tupperware started in what, 47. So it's not that it's a problem. Just make sure that, with the specifically the Crystal Geyser or any water bottle, you hold it up to the light around the rim or the shoulder of the bottle, it's going to have a date. And that date usually tells you what it is. So just don't freeze them. Don't keep them in your car till they heat up. Yeah, that's the main one.
And in the car. Okay.
Don't put them in your car. If you're concerned about the plastic, convert them into steel, glass, or you can use copper. Okay. And therefore, that you're actually in good space. But usually when you have those waters, they're pretty clear, just as long as you're in a cool, dark place and that date is in effect. Mm-hmm. But yeah, we all have a plastic problem. It's a plastic problem. Yeah, we got a world problem. That's a world problem. But you're fine if you're doing it with the eyes. Yeah.
Because I leave them in my car sometimes.
Oh,
girl, you better stop.
Don't do that.
Don't do that.
Never leave them in the car.
That car will beat that water up big time.
You might as well throw that water out. Yeah.
Oh, wow.
That's equivalent to when you pull up to a gas station and you see the water outside before you go in and sitting out in the sunshine. Don't drink that water.
Don't drink that water.
Don't drink that water. You didn't heated that water up. That's plastic. You drinking plastic.
Yep. You drinking PFAS.
And don't freeze them. Y'all hear me? Don't freeze them.
Right.
Don't freeze them.
Unless you're going to use it for plantar fasciitis on your foot.
Well, what about water transported in tractor trailers?
Okay, when they ship water, that's usually shipped in room temperature.
Mm-hmm.
Got it? So like Crystal Geyser and all those water companies, they ship them in room temperature.
Right.
The plastic the reusable rate for plastic, always, if you look under the very bottom, it's a triangle. That triangle has in there, the reusable rate for plastic is a 7. Usually most water bottles are a one time. So that means you're sipped in room temperature. As long as they're in room temperature, they're not supposed to leach. That's what the date is on there. Because the date says something like 2 or 3 years. So wait a minute. I mean, the water expired? No, water doesn't expire. The bottle expires.
Bottle
Got it?
expires.
You got it? That's the whole point. So that's why they put it on there. Most people don't know that. But I'm saying I'm just kind of giving you the options that you have. Some people are still like, I'm still not going to drink it because it's plastic. I get it. But just understand that there's a plastic problem everywhere. It's not just if they're finding it at the bottom of the deepest part of the ocean, it's everywhere. Okay. I guarantee you it's everywhere. So just do the best you can. Get you a good water.
Well, I'm glad you told me that.
Yeah.
It's in my car and I froze it.
No.
Throw them out. Just chunk them out. Chunk them out, girl.
You got two
Put
bad
it in the
boys.
refrigerator though, right?
Okay, last thing is you can have chill water, but don't freeze it. Okay. When you freeze it, remember cold binds. Got it? Cold binds. Remember, if you freeze it, it starts to now bind to the plastic and it now expands it. So now it won't even stand up. Remember, they fall down. They won't even sit up because it starts to get round at the bottom.
Right.
So now when you take it out and you sitting in your car waiting for it to thaw out because you got a little ice in it, well, whatever bound together is now releasing together. Now you're drinking plastic. Guaranteed. Got it?
Okay.
So don't do that. Don't freeze them and don't keep them in hot temperatures like your car.
Okay.
Okay.
All right.
All right, Deborah. Very good. All right, Nita, you're up next.
Good stuff, though. Good stuff. Good question.
Grand risings, everyone.
Grand risings.
I'm sorry for that. I'm multitasking here. I'm trying to watch TV and I'm on a computer because I'm so excited because I'm at an NBA draft party and I'm waiting for.
You better stop, girl. What you talking about?
You should see the buffet. Oh my gosh.
Well, who are you waiting for, Nifa? Who are you waiting for?
His name is Emmanuel Sharp. He played for the Houston Cougars. He just graduated college and all the teams want him. So we are all here in Kissimmee, as some people call Kissimmee.
Kissimmee in Florida.
And we're just waiting. And so I came out here on the patio. So I said, I got to get on my Zoom. I can't miss. So I'm watching the TV and keep looking. And I said, I hope I can get my question before they call because I'll have to jump up and run in there.
Well, get your question in, girl, so you can
let's give him a shout out. Let's give Emmanuel Sharp a shout out. Everybody give him a shout out. Yes, hopefully.
Already, congrats, man. We know you're going high, brother.
Yeah.
I'll let you guys know who takes them.
Okay, sounds good.
We're here. We got the cameras here, and we're just waiting.
All right.
Well,
all right.
We the Sixers. We need them over here. We need them playing.
He doesn't care where he goes.
Time.
Okay. All right.
Anyway, I want to ask this question real quick because I talked to sometimes I'm talking to people on the Zoom, and I happen to be speaking to someone, and I told her you should ask the question, but I told her I will because she's taking a few supplements. And she's taking Gymneva, and she didn't remember what it was for, but I told her maybe a lot of people it's for controlling your blood sugar. But she has osteoporosis, and she's taking the calcium, and she's taking the bamboo, and she wanted to know, should I be taking both of them? And I said,
the calcium?
Yeah. Yeah, I said, and the silica. I said, that's a question for Dr. Paul. I'm not sure if you need both of them or not.
Yeah, it's usually it's based on her situation. My question is always going to be what are you eating? Usually calcium, I try to stay away. If there's any calcium you would add, I go in the route of coral calcium out of the ocean, as opposed to that. Along with that, it can only support the bamboo, but the silica does very well on its own. Usually when you get that silica, you start to really get that bone density back. You'll notice that just like a bamboo, how hard it is, it starts to really strengthen those areas, the joints, ligaments, connective tissue, and things like that. So it's really based on the person, individual. I would say they would need an assessment before you can determine if they need both or just one.
Yeah. She's seen you, but she had that question for me, and as I said, I'm not certain, but I think she did say she is taking coral calcium.
Yeah, I really try not to do too much. You try to let the work with that one herb. I always talk to y'all about, work with one. These herbs and nutrients been around 1 billion years. They don't need too much help. So combinations or complexes can cause more confusion sometimes. So that's why I would say work with one, get the effects of how it makes you feel, and then you can add slowly if you have to.
And the one other thing real quick is just to let people know, because like I said, I'm your health advocate and I do get a lot of calls and we talk. When you're doing your pH, checking your pH, you have to check your urine and the saliva.
Yes.
Not just one and say, oh, my pH been good. And they only checking one. No, you need to check both.
That is so one. That is so good. Thank you, Nathan, for bringing that up, because that's exactly what everybody say. Oh, I'm good. I'm good. I'm a 7.0. I said, okay, you mean after you do both? What do you mean both?
Yeah, I know that's right. Yeah. What you smoking?
I just do the saliva. What else is there? No, you're supposed to do both. A lot of people don't know that the functional pH. That is it. It's called functional pH, and of course, if you deal with allopathic medicine, they're going to say, oh, well, the pH never changes. It's the pH in the blood. No, they're talking pH in the blood. We're talking functional. That's the beginning and the end. So that's why you double the saliva, add to the urine, divide by 3. That's what gives you what you need. So make sure you're looking at those numbers. You're trying to be between where, family? Where are we trying to be between what? Between pH of what?
7.
6.5
and 7.5.
7.5.
7.5.
No lower than 6.5. If you can make sure that range, we try to say, and that's basically taking both saliva and urine. That's your functional pH numbers. Yeah. All right. Good stuff.
All right, Lisa.
Thank you, Lisa. Appreciate you, Lisa.
All right, Lisa, and then Lydia. Lisa?
No. Can you hear me?
Yes, I can. Go ahead.
Okay, my question is for Dr. Paul. Are you vegan?
What was that?
Are you vegan?
Am I vegan? No, I'm pescatarian.
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 Oh, so you eat a lot of fish.
Right. Okay. I basically am it's a spiritual understanding also. I'm in part of the Essenes. The Essenes diet is fruit, vegetables, nuts, berries, seeds, and a little fish. It's a Christ diet, Christ conscious diet. And the Essenes were where Christ actually participated when he was fasting, and they helped him through the processes. If you can punch in Essenes, you can see Essenes diet. You remember there used to be a Essenes market in Philly? Y'all remember that? There used to be a Essenes market down off of
4th
South
Street.
Up on Bainbridge.
Below Bainbridge.
So that's where I participate, because when I started to look at, when I do the scriptures and look at what, do what Jesus did, that's what I walk that same walk, and it works for me.
Yep.
That's what it works for me.
Is that ASCAMS?
ESSENES.
Okay. I'll look that up. Thank you.
Yeah. Okay.
They used to have a market or a store down here on 4th Street. I'm down here. I'm in Philly.
Yes.
Yeah.
Yeah.
They're not there anymore.
Yeah, they're not there anymore. Yeah. But that was the first one before Whole Foods. Y'all remember that? You remember that? Before Whole Foods, they were the ones that was like, hey, they was keeping it real. We could come all over from the city, come right to that spot, because that was where you can get some natural foods. Yeah.
Yep.
I remember that. Yeah.
Okay.
Good stuff.
All right, Lydia, you're up.
Hi, family. Hi, Dr.
Well, glad to see you, child. Lydia been chilling.
I'm telling you, a friend of mine has vertigo real bad, and I told her I would put it in the chat. I said he's going. First thing you'll say is clean blood. That's the first thing. But other than that, she wants to know what can she do.
With vertigo,
and I told her she really needs to get an assessment and get there. But she's really having a time with that.
Yeah, vertigo, I would definitely get with somebody like Dr. Lenny first, because structural issues tend to be a big problem. And here's the wrong part, y'all. A lot of that goes back to water. Again, with the myofascial, which means you're so dehydrated, it pulls the moisture out of your muscles, and then the muscles get so tight. And is Doc still on? Doc probably left already, right? He probably left.
Yeah, I'm seeing him now.
Right. It pulls from that C1, C2 atlas axis right around that area of the S1 and the S2, the C1, C2, I'm sorry, C1, C2. And that's right where your vertigo, it causes dizziness right there. So it's going back to what? Water. Some of the biggest problems are water when it comes to vertigo. Now, sometimes if you've already been checked out and you know that there's, nothing wrong with the spine, no subluxations, anything going on, then definitely you want to try to maybe ask also the chiropractor or the practitioner, what about the Epley maneuver? Because the Epley maneuver, you have crystals in the ear, and sometimes that causes problems too, and they get trapped in that circle.
Right.
And then therefore you can do what's called the Epley maneuver. Okay. The Epley maneuver is something you can go right online and YouTube will show you how to do it. Or if you get it professionally done, someone like a chiropractor or practitioner can help you with that. Okay. That's where I would steer in that direction.
All right, Dr. P, can you unpin Nita?
Okay, thank you. I gotta go. I'm on another.
Okay.
Another Zoom.
Okay.
You watching the film? You watching the game too? What you doing over there?
No, I'm not watching the game. I have another Zoom. I'll tell you about it later. Okay.
All right. Take care. All right.
All right. Danny, you're next, and then Moto. Danny, you there? I know you're there.
I'm
there
here.
You go.
What's going on, guys?
Hey, Danny.
How you guys doing?
All right.
So mine is more of, I guess, testimonial, informational.
Okay.
It's not really a question. But this weekend was terrible. I thought I broke my back.
Uh-oh.
Nope, you're not allowed to do that, Danny.
I woke up and I was like, oh, something's not right. And it was going on for a couple of days. And I'm like, wait a minute. I gotta go see Dr. Lenny or something. I gotta go to the hospital. Something's not right. So then I, you start listening to your body. So I start moving and the pain started moving. And I'm like, what is going on? So I'm like, what did I eat? So I ate ice cream.
Oh, see that. You know it.
And then I can beat you up, didn't it?
I haven't ate real, because I don't eat dairy. So I haven't ate real ice cream in a long time. And I ate the whole pint.
Oh, Lord. Girl, that's the one you can stand up. What you talking about?
So I said, wait a minute. So I started going crazy with the green drink, and I've been drinking water like crazy, and all of a sudden everything just started flushing out. So I just wanted to let everybody know, stay away from that dairy. Dr. Paul said, stay away from that dairy, and I'm listening.
Stay away from that dairy.
Leave them glue makers alone, huh?
Leave them glue makers alone.
Yes, I'm staying away from it. I've been away from it for years, and then I was like, I just want a little taste, and I ate the whole pint.
And Danny, here's the wild part. All of it now is no longer ice cream. They call it desserts. They call it desserts. That means they're so bioengineered. All of it's bioengineered. Breyers is bioengineered. All of it is bioengineered now. And it will have on the back, it won't even say, because I've been walking around and a lot of the different ones say, all right, what are they saying? But they have a little smart scan that says, scan me. And when you scan it, it says what? Made with bioengineering ingredients. Yeah, and did y'all hear the recall this week? The recall was on Morningstar products.
Oh, yeah, I heard that just this morning.
Right? You heard that on Morningstar, right?
Yes.
Well, they've been bioengineered for a while. They've been bioengineered, period. So you shouldn't be messing with them anyway. Ain't this a mess? Everything is a mess. It's a mess.
Can't eat nothing.
Can't eat nothing. You should see my son. He goes to the market. He's like, I'm like, no, it's terrible. So do the best you can, Danny. But that's a great testimony. That's a stealth testimony.
Stealth, man.
Let's give Danny a hand. Danny, give him a hand, y'all. Come on.
At Danny's expense.
No, for real. Stay away from that dairy, y'all.
Stay away from that dairy. That casein.
Danny said Yes, that RBGH. Kick my humps, boy.
We got so much names for it. RBGH. Casein.
Yeah,
Elmer's
man.
glue.
It is the truth. That's exactly it, man.
Oh my goodness. Yes.
Okay. We had Moto. Moto, did you not want to ask your question because I saw you go off and your hand went down? Moto?
Okay.
There's Moto Styles. All right, Dr. P, if there's no one else, then we are at that time, but there's no one else there. And all the other questions have been answered pretty much. Dr. Glenda and Fingers too been kicking it, boy. Thank y'all. Appreciate it.
All right, so I think that's it, Big B. Tell them how they can actually be a part of the family tree, and they can get the transcript of the nice program. And not only that, but they can sew into the family tree and give Big B over there a little hand, y'all. Give him something. Drop a little dollar on the brother. How about that? Still something. All right, Big B, let them know. All right.
Listen, guys, in order to make sure you do get a copy of the nice chat, you got to do what? You know what it is. You got to send an email. Where? To mechavideo@gmail.com. Again, mechavideo@gmail.com. Of course, to continue to support the family tree, you want to use what? You want to use my Cash App. That's $BILMORGAN. $BILMORGAN. If you use Zelle through your bank to support, that ID number is mechavideo@comcast.net. Again, mechavideo@comcast.net. And finally, our P.O. Box over here in Mullica Hill. That's Bill Morgan. P.O. Box 191, Mullica Hill, New Jersey, 08062. Again, Bill Morgan, P.O. Box 191, Mullica Hill, New Jersey, 08062. Bring your friends, bring your enemies, bring your friends. What? Everybody, what? Right hand to the family tree. Yes,
all right. Did y'all learn anything tonight, y'all?
I know that's right. Yeah, buddy.
Come on. All right, that's right. We say this is a place where we give the information, but we don't charge you with anything, really.
Yes, sir, buddy.
But the truth, that means you got to go share it with somebody. Take this information, bless your heart, y'all. Do something, make sure somebody, be the odd one in the room and say, you know what? You need to put that pork down.
Well.
You need to put them ribs down. No matter what. Just stay on point. Let's give our host with the most, Big B, Bill 1L Morgan, a hand.
Yo,
also,
man.
I don't know if Miss Ruby actually had the bug on out of here. Is she still in here? We want to give her a shout.
See her.
Fingers number 2.
Fingers number 2 had to bounce, but the doctor went to pick up the slack.
Yeah. All right. So I just want to say, be encouraged. God bless y'all. May God keep y'all. And remember, if you're breathing, you gotta shine.
Yep.
All right. Come on, Marcy. Come on, Marcy.
Yep.
All right, come on. Tap. Tap. Come on. We're gonna get a little Qigong going. Hey, Pamela, I see you, Pamela. All right. All right. Lisa, let us know if you get in there, okay? Let us know. Tap. Okay. All right, come on down. Tap to the left. Tap to the right. Good. All right. Clap. Come on the hands and the arms. Little Qigong, y'all. On the outside. Throw that on the inside. Tap it. Gotta get that lymph moving, y'all. On the left side, do the right side. Don't forget the other side. Good. All right. Good. We see Joanne on there. She's tapping away. We got Sheila over there. We got Joan over there. All right. I want y'all to rotate the shoulders a little bit. Because you've been sitting for a while. All right, Debbie, you ain't been there. Come on, get back in that action, Debbie. Roll that shoulders backwards. Roll back. See how you rolling them back like that, baby? Yeah, there you go. And then you stop one way and go forward. Get that rotation. You gotta move them like this. See how you look like you're swimming. See how you're swimming like this.
Do the breaststroke.
Come on, do the breaststroke. That's right.
Do the breaststroke.
All right, got it. Now I want you to take your right hand, grab your left ear, like this. And I want you to just stretch this lightly. Don't pull nothing off, Big B. Don't pull your head off.
Don't fall off your chair.
Stretch. Hold that stretch. Good. Breathe and release. Good. On the other side. Do one side, you got to do the other side. Take the left hand, grab the right ear, and then pull slightly. Sitting a long time. You got to stretch that. Right. Feels good, don't it? Right. Good. Breathe. Breathe in. Breathe out.
Broke my neck.
Good. And release. Good. All right. Shake it out. 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 All right, baby. Breathe out. Good. Good. Breathe in. I want to thank our listeners over there on the phone. Breathe out.
Yep.
Also, Facebook
shout out to everybody on Facebook.
Facebook fam, give a shout
Andre,
out.
Lee Burgess over there.
Good. For those first timers coming through,
KK.
Appreciate y'all. All right, breathe out. That's right, we're here every Wednesday, 7 p.m. Come on in, bring somebody next time, right, Big B? All right, one more. And bring it out. Good. Take it out. Take it out. Take it out. Take it out. All right, let's get some energy, right? Come on. Back. Back. Good. We got to get that energy going. I want you to rub those hands together. Rub them real tight. Get that energy going. Okay. Good. Get that heat going, right? This is called the energy bath. You ever had a bath today? You're about to get a bath right now, Big B. You're about to get a bath right now. Probably didn't take one this morning, I know. All right, take it and just don't touch yourself. Just run it on down. Get that energy. Yeah, buddy. All right, good. You feel that? Ooh, wow, you feel that energy?
I heard that, buddy.
Come on, one more.
Yep.
And this one's going to be a little bit different. Clap. I want you to hold the bottom one still. Top to the top. See, if you grab it like that, you feel that energy. You feel like a ball in there. Energy. Feel your palms sort of pulsating.
I heard that.
That's amazing, isn't it?
Yeah, man.
Take that with good intentions. Bless yourself. God bless y'all. May God keep y'all. And thanks for tuning in to the family tree.
Yes, sir. Yes, sir. Yes, sir.
All right. Come on, Marcy. Come on, Marcy. Go, Marcy. Go, Marcy. Go, Marcy. Go, Marcy. Lead it off. Lead it off. Lead it off. Lead it off. Go ahead, Marcy. Go, Marcy. Can you stay up with Marcy Big B? Can you stay up with Marcy? Stay up with Marcy. I don't know, man. She going. All right, she's up here now.
Go get her.
Don't get you with the design. I'm gonna get with you there.
Hey, I'll break my neck trying to do what Marcy did. What you doing, boy?
Got a good one too. Got a good beat now. Come on. That's right. Go, Marcy. Go, Marcy. Go, Marcy. Go, Marcy.
Get it.
All right, you got the head. I like the head. You doing this? Yeah. You remember that one, right? That's right. All right.
Yep.
All right. Go, Jones. 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 That's right. That's right. Go, Jones. Go, Jones. You got a dip going on, baby. She got a dip.
Yes, sir.
You got the dip going.
I heard that.
All right. Go, Jones. Go, Jones. Go, Jones. Go, Jones. Go, Debbie. Go, Debbie. Go, Debbie. With the cat in the back. Go, Gabby. With the cat in the back. Go, Gabby. With the cat in the back. Go, Gabby.
I heard that.
With the cat. The cat is even jamming, Big D. Look at him.
That's right.
Go, cat. Go, cat. What's your cat name? What's the cat name? What's the cat name?
Seven.
All right.
Okay.
God's perfect number. God's perfect number. 7.
Go 7. Go
7.
Oh, that's funny. That's funny. All right. Go, Debbie. Go, Debbie. Go, Debbie.
I heard that.
All right. Go, Big B. Go, Big B. Go, Big B. All right, Big B. Come on.
Yeah,
come on, Big B. Come on, show him something, Big B. Go ahead. Go ahead, buddy. Go, buddy. Go ahead now. All right. Go, Big B. All right, I can't keep up with you, man. You too good for me.
You gotta be 84.
Go, Joanne. Go, Joanne. Go, Joanne. Go, Joanne. Go, Joanne. Go, Joanne. This you go, y'all. This you go, y'all.
Get it, Joanne. Get it,
Go ahead. Go, Joanne. Go, Joanne. Go.
All right.
You got it. All right. There you go. There you go. That's right. All right, Dolores. Go ahead, Dolores. Go ahead, Dolores.
One time.
Go ahead, Dolores.
All right.
There you go. She's up, Big B. She's dancing now. She's dancing. Go get it. Go get it. Go get it. She's jamming, Big.
See? Dolores, don't be playing with her. You don't know who you messing with.
All right. Go, Lawrence.
Yep.
Come on, Pam. Go, Pamela. Go, Pam. Put your hands up. Come on, man. There you go.
All right.
All right. This you go. She's holding back on us, Big B. She was holding back on us. Hey, Sheila, where you been, Sheila? Come on, Sheila. Go, Sheila. Come on, throw your hands up or something, Sheila. You gotta throw something. What's up, Roger? I see you back there, Roger.
Back ride.
Go, Sheila. All right, y'all. We're gonna wrap it on up. I think I got everybody. Did I get everybody? I got everybody. Everybody didn't dance on themselves. No way. Y'all done danced everybody out the room. They done danced everybody out the room.
Everybody out, man.
All right, we're gonna get it rocking and rolling.
Yes, sir.
Want to thank y'all for tuning in.
As always.
We're gonna end it up. And Big B, where we gonna be, buddy? Where we gonna be?
You got it, but as always, guys, 96.1 FM, 900 AM, WOD Radio, Black Talk Radio, right here at Philadelphia.
That's right. All right. 10, 9.
You got it now.
8.
Come on now.
7.
All right now.
6.
Okay now.
5.
All right now.
4.
Come on now.
3.
Come on, y'all.
2.
All right now.
And 1. God bless y'all. May God keep y'all. Thanks for tuning in. The family.
We'll wrap it on up now.
All right.
Okay.
All right. Keep it on dancing, y'all. Love y'all. Love, peace, and care. See y'all later.
All right, boy.
All right. Take care.